cause more serious illness. Currently, there's 1 confirmed case of the novel coronavirus in Washington and 5 confirmed cases in the entire United States. Our staff are working with our local healthcare providers and public health colleagues in Washington and at the Centers for Disease Control and Prevention to promptly identify any possible additional cases for evaluation in order to minimize any risk of spread. Each day, public health staff communicate with any persons being tested, which are called PUI, persons under investigation, and the close contacts of the known confirmed case to monitor their health and to arrange evaluation and testing at CDC if symptoms of the novel coronavirus are present. Now, close contact means caring for, living with, visiting, or sharing a room with someone who is sick with this novel coronavirus infection. Close contact can also include having direct contact with infectious secretions, such as a sick person coughs directly in your face. And people who are being investigated for this infection are isolated and remain at home until the tests are available, and they are actively monitored by our team. Since January 21st, we've identified 6 King County residents who are investigated for novel coronavirus infection. At this time, 2 of those persons have tested negative for the novel coronavirus, and results are pending on the remaining 4, but I do not have a high level of suspicion that those people will test positive. Those people are also under active symptom watch, as I described. So the public health system considers this outbreak a very serious public health threat, but it is really important to understand that the novel coronavirus is not spreading in communities anywhere in the United States. And the health risk to the general public from novel coronavirus in the U.S. and in King County is low. For perspective, it's useful to remember that in a bad flu season in King County alone, we can see several 100,000 flu cases and hospitalizations and hundreds of flu deaths. Each year, influenza infects tens of millions of Americans and causes tens of thousands of deaths. The novel coronavirus outbreak continues to evolve rapidly with increasing reports of cases from China and cases identified in other countries. It's fair to say this infection can cause severe illness and is able to spread from person to person. However, the spectrum of illness, in other words, how many mild cases there are and how many severe cases among them, and exactly how it spreads and how rapidly it spreads are not known with certainty. Other coronaviruses that infect humans spread from someone that is ill with the infection primarily by close person-to-person contact, mostly by respiratory droplets produced when the infected person coughs or sneezes. I expect over the coming days more cases will be identified both internationally and in the U.S., possibly locally, before the outbreak ends. Based on what is known, infection from novel coronaviruses start between 2 and 14 days after exposure. Therefore, for travelers who have recently been to Wuhan, if you develop symptoms of fever, cough, or shortness of breath within 14 days, contact your healthcare provider and be sure to call ahead to let them know about your recent travel and your symptoms. It's important to know that you're not considered at risk of novel coronavirus infection and do not need to seek medical evaluation for the virus if you have not had recent travel from the Wuhan region, if you have not been identified as a close contact of a confirmed novel coronavirus case or a suspected case, and if you are not ill, even if you have traveled to an area where there's an outbreak of novel coronavirus. CDC is currently recommending that travelers avoid all non-essential travel to Hubei province, China, including Wuhan at this time, and people traveling to other parts of China should practice enhanced precautions. And it's a good idea for anyone planning travel anywhere to check CDC's travel notices on their website, regardless of their destination. In addition to novel coronavirus, there are other infectious diseases much more common that travelers should be aware of and take precautions for wherever they are headed. It's also important to know that the risk of novel coronavirus in the U.S. is associated with exposure to travel or to a known coronavirus case, but not related to ethnicity or nationality. We do not have transmission of this virus in our communities, and people in the U.S. travel to China and other parts of the world for many reasons, including for business and tourism. Even if someone has been to an affected region, it does not mean they present any risk to others. National and local public health agencies across the country are on high alert and actively engaged in the response to this emerging disease. A few of our local activities at Public Health Center in King County include working with leadership at our King County healthcare facilities and our Northwest Healthcare Response Network to ensure their readiness to evaluate and treat novel coronavirus patients, providing information and health advisories and guidance to our healthcare providers and hospitals regarding screening, identification, testing, and infection control measures to prevent transmission in the healthcare setting and in the community for persons meeting CDC criteria for investigation, setting up systems to track and monitor the health of contacts of cases and persons who meet criteria for testing, providing and updating information to the public through our Public Health Insider blog. I encourage you to visit that site regularly as information is updated and posted there. We work closely with and are getting great support from our colleagues at Washington State Department of Health, the Northwest Healthcare Response Network, and the CDC, both here and in Atlanta, in assisting in the response to the first U.S. case. And I want to call out for special appreciation our colleagues at Harborview Medical Center who have worked with us to establish a mobile clinical team based at Harborview that can do home assessments for persons who may need evaluation but do not have symptoms requiring a visit to a healthcare facility or an emergency department. And this allows us to reduce the risk of exposures both in the healthcare system and in the community. It's less logistically complicated than arranging transport to a healthcare facility, and it is less costly in resource saving. It preserves our limited ER capacity for those patients who need it, and it's also more acceptable to the persons being evaluated. This unanticipated outbreak is resulting in a large demand on our staff, working 24/7 since last week, including consulting with healthcare providers to assist in evaluation and management of cases, assessment of possible cases for testing, and identification and tracking information around contact and case contacts for coordination with the regional healthcare system and other response partners. We've activated our health and medical emergency command to coordinate department-wide activities and to help coordinate the many response activities that we need to carry out in collaboration with external partners, including identifying and managing surge staffing for the novel coronavirus response, in addition to the ongoing hepatitis A virus outbreak that we're experiencing here in Washington. So although it's not possible to currently predict the ultimate course or impact of this emerging outbreak, I just want to reiterate that at this time, we have no transmission of this novel coronavirus anywhere in the United States, that exposure is related to travel or contact with a known case, and we will continue to provide you updates and new information as it becomes available.
Thank you very much. Appreciate you joining us today. A couple questions. Councilmember Dunn.
Thank you, Mr. Chair, and thanks for having this briefing. I appreciate it. You know, it's just one of these things where just because we're having a government meeting on it, we don't want the public to, think that this is a bigger deal in our region maybe than it is, or create any kind of public hysteria, and yet it's still prudent, I think, to have the information sharing exercise. So thank you for coming, Chief. I appreciate it. Couple of questions. The first is, this council some years ago made about a $6 million investment in Tamiflu. And I know that, just very sort of generally relating to the possibility of a pandemic some future time. I know Tamiflu has a shelf life. And I guess the question I have is, do we have the provisions necessary to be in a position like we once were, or are there any recommendations on what we might be able to do here as a council in terms of budgeting that would put us in a better position, not just for this issue, but for all pandemic flu types things we might see in the future?
Thank you, Council Member. So Tamiflu is an important medical countermeasure for influenza. This particular coronavirus and other coronaviruses, unfortunately, we don't have a vaccine or antiviral drugs that are known to be effective at this time, although people are now working furiously to test and develop those countermeasures. With respect to preparedness, in general, I can tell you, as I mentioned, the federal funding on which we rely greatly upon for public health emergency preparedness has been decreasing for 10 years. As you know, our health department is quite excellent, but I would say we've learned to make the most out of a bare bones capacity. No health department in the U.S. is adequately funded to meet the needs of a sustained, long-term, increased surge that a large-scale pandemic would require. So what that means is emergency funding would need to become available. just in time to sustain those types of responses. And of course, it's very challenging to bring on staff and hire people and train them and have them be familiar enough with the community and the healthcare system to function optimally under those circumstances. So to the extent that the capacity of the public health system could be enhanced to have more sustainable, robust capacity to meet these types of challenges, I think it would be very valuable and much appreciated.
Thank you for that response. That's helpful. And, there's a reason why we create rainy day and also reserve funds. And it's not just because we might have a downturn in the economy and have to absorb a bunch of revenue losses, but also for natural disasters and health-related issues as well. So we are in a position to pivot in a substantial way if necessary. And I want to just be very clear, this is just a hypothetical that I'm asking. If the situation with what is known as coronavirus, it spikes, there's always a lifespan to these things. If it were to become more contagious and you did feel that the threat level, which is now low, as you state, needs to be modified in some way, how will that look to policymakers and to the public at large? What would you do in that circumstance?
Thanks for that question. It's an important question that people are thinking about at every level of the public health system. First of all, the people who have the most information as it emerges from mostly China right now are our colleagues in Atlanta at the Centers for Disease Control and Prevention. And we rely on them to inform us about the emerging science, about how this virus spreads, how transmissible it is, and how serious it is. And if you remember, during the early days of the H1N1 influenza pandemic in 2009, the impression was that that virus was a lot more deadly and serious than it actually panned out to be. And in fact, there were many, many more mild and asymptomatic even infections of that influenza virus than you could ascertain at the onset of the outbreak. So depending on how severe this virus turns out to be overall and how transmissible it is, the response strategies would vary accordingly. So if, for example, it turns out this infection is going to be widespread like the common cold coronaviruses and transmit very easily and with little symptoms or no symptoms, it won't be possible for us to contain it by tracing someone's contacts. We won't even know who's infected and who their contacts are, yet transmission will be occurring. So this intense effort that's going on now across the country to identify infected people, to monitor them, to monitor their contacts, will probably be scaled back and discontinued because, widespread, low-grade, mild infections, that type of strategy is not effective or doesn't make sense. It's not resource intensive. It's very resource intensive and not productive. Other things that might happen if this virus is shown to be more transmissible will be, depending on where it's occurring and how widespread it is, advice to the public about how to prevent infection. So right now, the advice that we would give if this virus was circulating in the community is very similar to what we recommend during influenza season, because these viruses are transmitted by respiratory droplets. So what that means is stay away from people who are sick. If you're sick, don't go to school or work. Have really good hand hygiene. Wash your hands frequently. Do not touch your mouth, nose, or eyes with your hands. And disinfect your home environment or workplace environment regularly. All those steps will stop the spread of all respiratory viruses. Now, again, this virus isn't circulating here in Washington State. It's not circulating in King County. But those are good common sense measures that people can take today and keep them healthy from the viruses that are circulating, like influenza, RSV, rhinovirus, adenovirus, parainfluenza virus, and so on. So depending on exactly what we learn about how this virus transmits and how serious it is, the public health response will, adapt accordingly.
Thank you for that response.
Councilmember Lambert.
Thank you, Mr. Chair. So, in follow-up to what Councilmember was just saying, the idea that not only did the legislature not fully fund foundational public health in the entire state, and in a meeting I was at with commissioners and council members across the state last week, they were talking about the dollar amount, and I said, King County alone could use the entire amount we're talking about. And people were shocked. So I think the nexus between how much money we get from the state and what even foundational public health is still not enough. to deal with these kinds of things. So that's the first thing I wanted to say. Secondly, you said call ahead to the hospital. I did call ahead in 2003 when I came back from China, and I thought I could possibly have SARS. What I was not expecting was that they gave me an appointment time, and when I got there, they were dressed in hazmat suits. I was not expecting that, and that was very disconcerting. So it isn't like I'm in the parking lot, can I come in? But here's no time because they need to suit up. And so I think people should know that because it was, as I said, very disconcerting. You did say enhanced protection. When you say people should take enhanced protections, what does that mean?
The CDC travel advisory?
Yes.
Yeah, so for Hubei province and Wuhan, the advice is postpone all non-essential travel. So basically, they're saying don't go there unless for some reason you really have to. Enhanced precautions mean things like staying away from people who are ill, wearing a face mask perhaps if you're in public location where there are ill people, staying away from the live animal markets, things where you would ordinarily not think about. So there's a little paragraph on the CDC Traveler Health site that advises people about steps they can take to protect themselves that they wouldn't ordinarily think about, but short of saying don't go there.
Councilmember Balducci.
Thank you, Mr. Chair, and thank you, Dr. Ditchin, for coming here. I know you all have a lot to do and right now. I think what I'm hearing from constituents is just that I think in some sense the news has spread faster than the germs have spread, and so there's a lot of fear. And I think the reaction of the Chinese government has caused people to raise their eyebrow and say, is it really that bad that they're cordoning off such large sections? So you said it very quickly, and I'll ask you to say it again slowly for the cameras. Where can people go to find out and keep up to date on information that will impact what they need to know about our local community and risks and how to avoid them?
Yeah, so there are a couple of really good sources of information. Thanks for asking, Councilmember. There are, in King County, our King County Public Health website and our Public Health Insider blog. You can just Google either of those, King County Public Health Insider, and get right to those sites. We post updated information there. The Centers for Disease Control and Prevention is the most authoritative site where people can get good information about what's happening internationally, nationally. There's a Q&A with frequently asked questions. There's information for healthcare providers and the public. And they have regular situation updates on that site. And then our Washington State Department of Health site for those listeners who might be outside of King County and in other counties, and then their own local health jurisdiction websites can give them the information about their immediate environment.
Thank you very much.
Thank
Appreciate
you.
everything you and your team are doing.
Thank you very much for sharing the information with us in your presentation today. As Councilmember Lambert has already alluded, it underscores the need for preparedness and foundational work from our public health department. In fact, again, underscores that public health knows no boundaries, that the case in Washington State, I believe, is actually a resident of Snohomish County, yet you've said we're monitoring people who have had contact with the known case in King County. Transmissions don't know political boundaries and underscores the need for preparedness throughout the state, throughout the country. Really, public health is knows no boundaries. And whether it's investments in foundational public health, emergency preparedness, and recognizing that we're all in this together. These are important reminders for us even as we talk about the one case here that there's not transmission and the low level of concern you've asked the public to have, but still to make sure that we're aware. We know that our public health department is at work protecting us.
Thank you for the opportunity.
Thank you very much. That will take us, we'll go back to item 6 on today's agenda. This is motion 2019-484. And this is the appointment of